Hi, this is Dr. Scott Hoar. Today is Treatment Tuesday, and today our patient is Peter. Peter is a massage therapist here at Alcoa Chiropractic and head therapist as well. And he's been dealing with some low back pain for a while. So Peter, why don't you tell us a little bit about that?
Let's see, a couple of years ago, I actually had to have surgery on my low back because I had 2 bulging discs. It just gave me a lot of pain for quite a while. I was working here at the time, and we tried everything we could before I was referred to a neurosurgeon who suggested I had surgery.
What kind of surgery did you do?
I had 2 discectomies, so the last 2 discs in my spine they did a discectomy on. So I did pretty well with that after I recovered, but it still gives me trouble every now and then. And recently, like the past 2.5 months or so, it kind of flared up again, and I've had pretty consistent pain kind of in the low back going into my right hip. And it's just concerning me because it's kind of getting in the way of some of the things I like to do, like doing yoga, and I'm concerned about how it's going to affect me long term, like with stuff like running and stuff. So I'm not able to get into the full range of motion. Like I can't go into a full forward fold without bending my knee a little bit. And it's just frustrating because I used to be able to do that stuff.
Okay.
If I'm moving, I'm usually pretty good. Sometimes it can be a little sore through there, but a lot of times if I'm standing still, I'll get pretty serious pain in the low back and deep into the hip.
Well, let's get to it. Okay, so what we saw with Peter, his bending over and touching his toes, which he referred to as his forward fold during yoga, you could tell that was a little bit hesitant. The range of motion wasn't terrible, but it also was not comfortable. So we're going to look at his ability to flex through his hips while he's stabilizing his spine. Leaning back, the same sort of thing. We would call that a hip extension type movement. When he leaned back, it was not terribly comfortable. He also mentioned that he's been having some spasm on the kind of the right lower side. So we're going to see his ability to flex and extend through his hips. We also noticed when he rotated his head to the right, that was a little bit limited, a little bit of stiffness and discomfort with his shoulder motion. So we'll get him a little bit of treatment for his upper body, because whenever there's limitations of the upper body, it impacts the lower body. So we'll do the upper body, and then of course we'll do a deep dive into his ability to extend and move through his hips to keep his lower back healthy. So let's get to it. You love having this camera right in your face. Try to keep your eyes open.
Okay.
I know it's going to be weird, but you can deal. So the vast majority, we said, what did we say, left rotation or the right rotation was the limited one?
Right.
Yeah. Okay. Vast majority of rotation in the neck actually happens at the C1, C2 segment. So I'm going to adjust up there when we're on the left side. A little bit of restriction right here. Make sure the microphone's right there. All right, you ready? Very good.
That was a big one.
You okay?
Yeah, I'm good.
All right. Okay. You good? Yeah, right there. You could tell. A little bit limited. Do you feel that?
I do, yeah.
All right, let's let it go. Very good. All right. How was that?
It was good.
Good. All right. And boom, right rotation's good. Left rotation. Actually, that's now a little bit more of the limited one. Would you agree?
Yeah, a little bit.
All right. So then I'm going to go in and do a little bit of a soft tissue release. See if any of that is limiting your motion. So, as a massage therapist, what is, other than your lower back, what gets beaten up the most on you? I would think wrists.
Definitely my wrists.
Yeah.
I've had tendonitis a few times in both wrists, so.
Manual therapy is very difficult on the practitioner.
It is. I like doing it though, so.
All right, a little bit better. Okay, and then let's see, which shoulder was it? That was a little bit stiffer.
Am I right?
Well, we'll start here. All right, I'm going to make a muscle test. Make a fist. I'm going to push down on your elbow. Resist that. That's very good. Put your thumb and pinky together. I'm going to pull apart. Don't let me do that. That's great. Elbow in at your rib cage. I'm going to pull out towards me. Resist that. Very strong. Make a fist. I'm going to push down towards you. And that's a little bit weak. I'm going to test on the other side. Pushing down. I think that's stronger. All right, so we're going to adjust your shoulder girdle on the left side. I want you to put your left palm in your ear. Good. Take a nice deep breath. Breathe in out. Very good. All right. Make a fist. Pushing down. Don't let me. There we go. Much better. Make a fist. Pushing down. Really strong. Thumb, pinky. Pulling apart. Lovely. Elbow in at your rib cage. I'm going to pull it up towards me. Don't let me do that. Good. Make a fist. Pushing down. I think we already did that one. Okay, cool. So you could see this is the scar right here where he had his surgeries. Is it tender when I touch there?
No, it's not.
How long ago was it?
I think about 2.5 years now.
Okay. All right. Good. Relax your shoulders. Windy out there. Take a deep breath for me. Let it all out. Good. Okay. A little stiff up here today. All right, let that go right there. A little bit right over there. Let your head go back there. Oh gosh, you got a tough spot.
What, right through there?
Yeah. You feel it?
Yeah.
I think I'm probably gonna have to hit that from the other side. Yeah. All right. Take a deep breath. Breathe on out. Good. Okay. Flip around on your back. When I was, I went to chiropractic school in Florida, and I come from a long line of heavy sweaters. And as I learned, as I was in chiropractic school, you know, you have to wear your lab coat as you're treating. So you normal clothes and then a lab coat in Florida, and you're already nervous and you're not terribly good at what you're doing. I would sweat hard. And I decided right then and there, I'm not going to be able to practice in Florida. So let's try to get that trouble spot here. Scooch down a little bit. Right there is very, very stiff. I want you to put your chin all the way up. Good. And keep your chin to your chest. There we go. Does that hurt?
A little bit, it's okay.
All right. Let's get into your lower body. So internal rotation of the hip is definitely a little bit limited. Do you feel some stiffness there? Do you feel any discomfort?
No.
Okay. Same sort of thing. Not actually amazing internal rotation of the hip. And that does impact the overall just comfort of your hip when it's doing other motions. So your hip flexion, you can flex to about, what is this, about 100 degrees right here. When you go above it, you're automatically going to tilt your pelvis and move your lower back, which we really wouldn't want. So when you do something like a squat, you don't actually want to go terribly deep. Okay. Given your God-given anatomy of what your hip flexibility is, you just, when your knee goes up too high, you're going to do this whole tucking of your pelvis sort of thing. That's really going to beat up on your pelvis and your lower back. So keep that in mind as you do your yoga activities. Right about there, that's your comfort zone. Above, you're no longer flexing through your hip, you're moving through your lower back. Yeah. So basically, I would want to use the drop mechanism that we have on our normal tables. Instead, I'm going to use the speeder board because I'm going to adjust your hip to get a little bit more internal rotation flexibility. So raise your butt up just a snare. That's good right there. And what I'm going to do, take it in right there, find the limited spot, and do that. And nothing will happen. Having said that, just because you don't have a speeder board making a noise, or actually shifting, it was just a little bit more like me punching your hip, but we get a little bit of motion there. Good. Good. All right, we'll just do a little bit of we actually call this scouring the hip. I'm sure it feels amazing. Good. All right, a little bit better there.
Is there anything in particular that would cause the hips to be limited in internal rotation?
Mainly life being against you.
Okay, cool.
No, I mean, like I get questions like that all the time.
Like, is this too tight or is that too tight? You know what I mean?
Yeah, well, it is too tight. The internal rotation of both hips are too tight. Is it because of something you're doing? Possibly. Is it just your body in its natural process of kind of breaking down and making alterations? That's possible too.
Okay.
So then it's our job to just find your imbalances and address them and kind of go from there. You know, I know that's probably not the answer you're looking for.
That's fine.
Hold it right there. I'm going to push down. Don't let me do that. Ready? Again. Very weak. Other side. Pushing down. Big difference. All right, turn on your side, face that way. Deep breath. Breathe out. Good. Pushing down, don't let me. Much better. Let's test some other stuff. Hold it right there. I'm going to push down and out. Resist that. Okay, down and out. Both of those are a little weak. Keep these legs together. I'm going to pull this one leg towards me like that. Don't let me do that. That's tough. This one, pulling this way. Don't let me do that. It's a lot stronger, isn't it? Mm-hmm. Why don't you flip around on your belly? Hold it right there. I'm going to straighten your knee. Don't let me. Good, other side. Straightening your knee. Fine. Knee up. Pushing down. Okay. Knee up. Pushing down. That's the weak one, isn't it? Turn on your side. This side up. Deep breath. Let it go. Good. Knee up. Hold it right there. Pushing down. There we go. Better, yeah? Yeah. I'm going to grab your psoas when I say so. I want you to straighten your leg. Go back as far as you can. And go for it. Good. And back to neutral. And again. Good. And again, what we're trying to do, Peter, we want to open up whatever restrictions you might have in your hip movement. Ready to go? So that your hips have much more ease of movement, and that leads to your pelvis and your lower back moving less. Ready to go? Pushing into the psoas, straighten, and back as far as you can. Go for it. Go, 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 go. Back to neutral. How's that feel?
Feels tight.
You look like you're having a terrible time. Okay. And again, go. Yeah. Okay. And go. Okay. All right. Good.
Okay, that's easier.
Yeah.
Thank you.
Yeah. You're in a good position there. Stay nice and tall. Work your belly breathing. Sorry. Yeah. That's it. And you feel healthy now. That's it. So this was Dr. Scott Hoar, Treatment Tuesday. Don't forget to hit the like button, the subscribe button, leave a comment below, and look for our next Treatment Tuesday. Take care. There you go. That's it. All right, good.
I see what you mean about when it's at the top engaging the lats.
Uh-huh.
That was better.